724,079 PCR tests since the beginning of the pandemic. We've tested 416,927 patients, and 65,142 of those have been positive, for a total percentage positive of about 15.3%. And if you look at just Baptist Memphis, those numbers are 66,175 people tested, 6,785 have been positive, for a total of 9.9%. And if we look at hospitalizations, there are currently 16 people at Baptist Memphis in the acute care beds, not in the ICU, and there are 4 people in the ICU, for a total of 20 with COVID at Baptist Memphis. 3 of those 4 people in the ICU are on ventilators. At Baptist DeSoto, there are 6 people in non-ICU beds with COVID. There are 2 in the intensive care unit, and both of those 2 people in the ICUs are on ventilators. So our numbers had come down to the 12 range or so for a bit, and now we're back up slightly, back up to 20. So we have seen a few more in the way of COVID admissions over the last few days, and have run those numbers up back to 20. We hope that trend will not continue, but very honestly, with the Delta variant out there, more cases are expected, likely will follow what we've seen in Missouri and a couple other states that are nearby and have just experienced what we're seeing a little bit sooner than we did. So the concern is, of course, that will continue for a time. Again, not anything like what we've seen in the past, I don't think, but still a lot of people out there unprotected. So we could see some significant increase in numbers. So happy to answer any questions if there are any.
Can you hear me, Dr. Threlkeld?
I can.
Okay, great. Hi, how are you?
I'm fine, April. How are you?
I'm doing well, thank you. I just have a couple of questions. The first is your reaction to the World Health Organization saying people need to put their mask back on. Do you think, reaction to that, and do you think that we have loosened up restrictions too soon?
Yeah, so it's a very good question. I'm getting it a lot, and I think what we have to remember is the perspective that different regulatory bodies and the bodies that offer advice on COVID, they're different perspectives. So I pointed this out a lot with the CDC, but it even goes farther with the with the WHO. If we look at, I have one patient in my office to see at a time. The CDC has something north of 330 million people in their office to see at a time. And then that stretches even more impressively to the WHO, that has something just shy of 8 billion people that they have to take care of all in one fell swoop. So the perspective on COVID-19 when you're standing in Zimbabwe looks very different from the perspective on COVID-19 standing in Memphis or Peoria, Illinois, or anywhere in the United States. And the largest reason for that is quite simply the reason for some of the differences here within our country, and that is the vaccination rate. Almost nobody worldwide has been vaccinated compared to the numbers that we have seen, which is why Europe, Israel, the United States, that's where we see things doing by far the best. So the WHO has to take that into account. And we always take into account the amount of community transmission and the amount of susceptibility that we see in the community. So it's not necessarily a totally different thought for the WHO to suggest that worldwide and on average, people should be taking more precautions because they aren't vaccinated. But what I would say is that it is sort of a window in the fact in the United States that there are a lot of people who aren't vaccinated as well. About half of us or so are vaccinated. But if you look at it regionally, just to extend that sort of analogy, the place where we are is sort of right at the center of the funnel of decreased vaccination numbers. And because of that, we would certainly be right here in the crosshairs for if any, what surge or increased numbers of cases and severity that would be seen. So we don't sit in a very good geographic position for those sorts of issues. As to whether we pull back too soon, I think the answer is probably not. Things were better and things continue to be better for now, although there is an uptick, as we mentioned. We've certainly seen it in surrounding states. And all of those recommendations, requirements, have been based on what the community transmission rate is and what the real risk is to the citizens in this particular community. You look at, I think it's LA County that have actually brought back a voluntary, mind you, mask initiative for indoors or outdoors. So I think time will tell as to whether we have to rethink those guidelines and make them more stringent again. I can tell you that public sentiment is going to be against anything like that. But there will certainly be more people that are going to get this infection just because there's so many people who remain unvaccinated and unprotected. So I think it's something where they're going to have to watch very carefully.
You kind of mentioned my next question, just what we're seeing in our surrounding states, Mississippi and Arkansas, having some of the lowest vaccination rates. Should we in Tennessee be worried about that, especially in line that we have not had any deaths in Shelby County since, I think, last Tuesday?
Yeah, and so things are as good as they have been in a long time here as we speak now. And we have to be careful because I struggle sometimes to find the appropriate tone to use because I can't constantly strike the note that we're still in danger, return to your homes. That's not realistic, and it's not even true right now. But it is certainly the case that if you're unvaccinated, you are still in some danger, and the number of the people eligible to get it and therefore give it to you may be down because of vaccinations. But that's balanced and probably more than balanced by the increased infectivity or amount of contagiousness that these new variants possess. And so that virus is more likely to hunt you down, even though there are fewer people out there giving it to you. So that sort of balances out. So we have to be very careful about that. And I would say further, we still have young people now in the ICUs. And though there have not been any deaths in the last few days, we have a lot of sick people still in the hospitals, way fewer than we did, but some are, as you have heard, on the ventilators in the ICU, and some of those people will likely die before it's over. So I would just say that things are a lot better on hospitals. They're a lot better on me. I mean, I would much rather be responsible for 20 people in the hospital here than the 172 that we had once upon a time. But, I think you have to realize that just the fact that the hospital is having a better day, or that I'm having a better day in taking care of you in the ICU compared to what I had in October, is not very much consolation to you if you're the one on that ventilator in the ICU. So I think we have to be careful because just because the city is doing better, the hospitals are doing better, and healthcare providers are having a better time of it right now, that doesn't mean that you are protected or in a good situation if you're unvaccinated and unprotected against this more contagious vaccine. Remember that now almost mythical herd immunity depends on a couple of things. It depends on how many people have been vaccinated or have gotten immune from the infection. But it also depends on the contagiousness of the virus and the infectivity, and that's going up and up. And so measles herd immunity is north of 90% because it's so contagious. It doesn't take many people to get it to then give it to you. And that's the sort of trend that we're on with this vaccine. And a further item to think about really is that, yes, we're in that zone, and Memphis and vicinity tends to be sort of the funnel for healthcare for Eastern Arkansas, North Mississippi, West Tennessee, and even up into Missouri, where we're really seeing some increased numbers. There are a lot of transfers from those places to the Memphis area for higher levels of care. So we're, as I say, very much in the crosshairs for whatever problems that we do see. They will likely funnel to us in terms of the healthcare system. So we have to be, I think, that much more careful as we look forward in the coming weeks. That does not mean that we have to go back to mask mandates right now, but it certainly does mean that we need to be careful. And one other point, not to belabor it, but we do see some people who've even gotten quite ill who've been vaccinated with a relatively normal immune system. I've got a couple now in the hospital who've been vaccinated. They are reasonably normal as far as I can tell in their immune system, but they're sick and they're hospitalized. We don't see much of that, but what I might suggest and have suggested for some of these patients is that they seem to be sort of at the epicenter of a super spreading sort of situation. It might be an outbreak in a church or a family, and the person that got really sick from it may have just gotten the most virus exposed to them and put into their nose, and that may have overcome some of the immunity. So what I do personally right now is I don't wear a mask everywhere, certainly don't wear one outside much ever anymore. But in some situations, I always have a mask with me, whether there's a mandate or not, and no matter what the recommendations are, because if I'm in a particularly crowded place indoors, particularly if it has bad airflow or ventilation, then that's the kind of situation that you might be exposed to enough virus around somebody who's unvaccinated and unprotected, even with low symptoms, that you could have your immunity overcome. That's sort of a theory at this point, but I think it's a reasonably valid one. So I always have that mask, and in a situation where I feel like I'm at higher risk, I'll put it on in those situations, both to protect myself and because I'm around a lot of immunosuppressed people. So my getting it asymptomatically could do a lot of damage. And so I think those of us in healthcare have to be that much more careful about that.
Thank you so much.
You bet. Several.
Hey, Dr. Threlkeld, it's Kelly Roberts with Channel 5.
Hi, Kelly.
So just kind of talking about some of your comments at the beginning, referencing Missouri, Arkansas yesterday talked about basically they are seeing a surge in hospitals there. So are you saying that it's likely that even if it's delayed, that we may see the kind of surge in hospitals that Arkansas and Missouri and others are seeing eventually here in Tennessee?
Yeah, I think that, there's several things that we sort of know at this point. We certainly know what's going on as they are reporting their numbers. And as you say, they are, in some cases, a lot more impressively going up than we would like to see. We already have gone from 12 to 20 in our hospital in just a few days. That's not a statistical pattern particularly yet, but it certainly is bothersome. And we've had some transfers in from other towns in the area. And so those rises, surges, if you will, are likely to be represented in increased cases here too. I think absolutely that's the anticipated situation, because the Delta variant is really sort of hitting here now in larger numbers. I think the number was a third or so of the isolates that we sequenced over the last week or so were COVID, were Delta variants. We have a couple of Delta variant people in the ICU now, younger people. So I think we would be foolish not to look at what's going on in the immediate states around us. Also, particularly realizing that a lot of those folks are going to come here for healthcare if they get particularly ill. So yeah, I think that we're likely to see a push in cases. Will we see what we saw in October, where we were literally the epicenter of the world transmission? No, I don't think we're going to be in a situation anymore where healthcare facilities are being overloaded in Memphis. Now, they may be in smaller towns in Missouri and Arkansas. They can have serious problems with that even still. But, we're on the order of halfway protected if you look at vaccination. So there's still half the people out there that could get infected. The good thing for us is that a disproportionately vaccinated group of people would be those elderly who stand the highest risk of getting very sick, being hospitalized, and losing their life to this infection. So we have that going for us in terms of the picture that will be put upon us as a healthcare system. But yeah, I think we would be short-sighted if we didn't look at what's going on in Arkansas and Missouri and think that as Delta most assuredly will take over and essentially be all of the virus here in a matter of time. It is just outrunning all of the other variants, and most notably the UK or Alpha variant now, and it's just replacing it because it's a more efficient virus. It's infecting people faster, and so people are going to just about all have Delta variant in a matter of a few weeks likely. And whether that virus is significantly more dangerous, that still kind of remains to be seen. Remember, there's some data from Scotland and others that suggest that twice the number of people with Delta compared to Alpha are getting hospitalized, and we still need more data about that to verify it. But even if not, even if it's just the same degree of virulence or danger, there's going to be an uptick in cases. It's just a lot more contagious, and so more people will get the infection. And when more people get the infection, two things happen. A few of them will die, and we stand a higher risk around the region, the country, and of course, especially the world, that as that virus continues to make copies of itself, it'll still make mistakes. It will still make mutations and variations, which then some of them can be important in behavior, which we call variants. And those variants could be either more resistant to the vaccine immunity or to regular infection immunity, or they can be more contagious. And let's not forget the one other point about Delta, and because I think it probably sometimes is underappreciated and understressed, and that is that it is more resistant to vaccines. Not so much that second vaccine doesn't still do the job very nicely. It does. But if you look at the first vaccine, it's only about 30% immunity. And that's significantly lower than what we saw from some of the first variants with those RNA vaccines. So that's a step very much in the wrong direction. We don't want to see those steps continuing. It really would if they did. potentially put us in a situation where we'd have to have, I won't even call them boosters, but we would have to have new shots that would take into account those variants. Those are being developed. We can do them a lot faster than we used to with the RNA technology that we have now. So we have those things going for us. But I think if we have more and more resistance building up over time, then we'd be more likely to have to take that pathway. Even at a time, even as we look out there and see that the vaccines tend to last a long time. I mean, the idea that we have to have a booster after a year, the latest data coming out show that the immune system, it does very nicely, thanks, with the vaccines that we've seen, and even months out, they continue to look pretty good in the immunity that we have. So, despite the concern and thoughts that we might need boosters frequently, we don't have anything to say that just yet. So, the variation and the variants become the reason that we would have to have more vaccinations if we did, at least for now.
Hey, Dr. Threlkeld, it's Corinne. How are you?
Hey, Corinne, fine. How are you?
Doing pretty well. So you had mentioned that slight uptick in the number of hospitalized patients with COVID-19. Is it too early to say if this is really a trend, or are you concerned about seeing that uptick?
Well, I mean, two different questions. I'm definitely concerned because I think it will. I don't think we can call it a statistical trend here just yet. The fact that we not quite doubled our numbers, because our numbers were so low. I mean, if we'd gone from 20 to 40, I'd be even more concerned. But I'm definitely concerned that we're going to see more cases. I think we will. I think it is likely that the Delta variant will do a much more efficient job, as I like to say, of hunting people who are avoiding both the vaccine and infection. They are likely to be sought out by this more infectious virus. So I think that a lot of those people will get infected. The remaining folks who are at risk will increasingly get infected by these increasingly infectious variants. Now, again, the good news is that those people are not in as bad a spot as the original population of people in their 80s, who were the ones, if you take out nursing home residents, you take out a lot of the deaths of the original waves of this virus. So it'll be a lot easier for us to handle as a system. But once again, I emphasize that if you're the person who's unprotected and even young and lying there on a ventilator in the ICU, it's little consequence to you that I'm having a better day and not having to take care of as many people in the situation that you find yourself in. That just doesn't, that's not helpful to you. And so the fact that our numbers are down globally is less important than whether you are immune and vaccinated and protected. And I talked to a person today who just hadn't quite decided to get the vaccine. They were nervous about some medical problems that they had. And I said, look, that's the reason to get the vaccine. That's the reason to be concerned about COVID by many-fold more than the reason to be concerned about the vaccine. And we had a gentleman in the hospital a week or so ago and had just not bothered quite to get the vaccine. Wasn't against it, but just hadn't really gone to the trouble to go get the vaccine. And so we asked, had you gotten the vaccine? And he said, no, but I want one now. And I said, well, unfortunately, that didn't help us right now. So that's why, the drumbeat that I keep sounding is that we need to get vaccines into the doctor's offices where people can have it right next to them. They don't have to, they're there anyway. They don't have to go into any trouble. We've certainly been vaccinating some people in the hospitals that are willing to be vaccinated because in that situation, it's right there. You don't have to go to any trouble or logistical difficulty to reach the vaccine. And it is hoped that you have trusted people around you explaining what the risks really are and comparing them to the risks of not being vaccinated. So yeah, I am certainly concerned. Though we can't really call it a statistical trend yet in Memphis, we certainly know it's a statistical trend that the city and area is being overtaken by the Delta variant. That much we certainly can say, and I think it's almost certain that it will be the total infection in the city soon. And with that, it's more contagious. There will be more cases, and generally with that, we'll see eventually more hospitalizations and deaths. Though we won't see it in quite the proportion of those as when we were dealing with more of an elderly population being infected.
We're going to talk about heart inflammation and the vaccine.
Yeah, so that's one that obviously has taken over as one of the major concerns about people who are thinking about getting the vaccine. And it's interesting how some of these side effects have sort of replaced one another, and we don't necessarily talk about the ones that we were worried about in the beginning so much anymore. But the latest one, of course, is the myocarditis. And so what just the latest study that came out was on some people in the military. And they found in, I think, 460 some odd thousand people who were in this study, they found 23 cases of myocarditis. And myocarditis is nothing more than inflammation of the heart, generally manifest by some chest pain, maybe some other symptoms. It almost always goes away quietly and does fine. But we've seen a little bit higher. You would have expected 8 or so rather than 23 in that population, just that would have happened anyway. Forget the vaccine, forget anything else. 8 out of that many people in that age group would have come down with a case of myocarditis. It's a not uncommon viral infection. It's more common in men than women, boys than girls. So that sort of finding was not particularly a surprise at all. But what we have to remember is that in addition to it being something that everyone almost essentially gets over fine, we also remember that you get myocarditis from viral infections, including COVID, and there are cardiac complications, certainly from COVID. So in terms of the risk of myocarditis from the vaccine, it does appear that it is slightly increased, but in numbers so small that it pales in comparison to the protection that you get from that vaccine. The analogy that I give people in talking to them about it on an individual basis is that I can absolutely give you accounts that I have seen of people who have been more severely injured or even killed because they were wearing seatbelts. It absolutely does occur that sometimes seatbelts can cause more severe injury. But I think we would all agree that it would be foolish to go out and recommend that everybody stop wearing their seatbelts because of these very rare events. And that's the sort of thing we're talking about. Because of these very rare events, thankfully in this case, ones that people essentially all get over, with very rare exceptions, even to the rare exception of getting it in the first place from this vaccine, the protection that you get and the risk from COVID itself is so far greater than that, that it really pales in comparison. And so it should not in any way make someone statistically less likely to get the vaccine if you're really looking at the real numbers.
And then one more back around to Delta, even though we've talked about it a bunch. Should you make any special plans? You want to talk about that for 4th of July?
Yeah, the 4th of July. Yeah, that's the other question that I've certainly heard a lot about, and that is, well, what about the holiday? And I was telling somebody the other day, this is starting to feel more like Groundhog Day than the 4th of July, because it seems like just yesterday that we were looking at this, the first trip through COVID, and worried about spreading the virus to more people and causing more disease. And now, what do you know? We're looking at the similar question, thankfully at a much lower volume than we were looking at it the first time, but with a more contagious variant that somewhat makes up for that difference. So, I think that the 4th of July, people are going to travel. And when they do, I think the most important thing is just to pay attention to your symptoms. We still see a fair amount of transmission. We're going to see it with this variant, and you're going to have a higher chance of giving it to the entire family around you if you get this than you might have last 4th of July with the old Wuhan variant. So I would just encourage people to pay close attention to their symptoms, realizing that not everybody has significant symptoms, but still have a very low threshold to go get tested. And if you're positive, of course, to isolate in those circumstances. And then again, it's 4th of July, so take advantage of that and utilize the outdoors to try to have picnics and things rather than indoor in a dining room that has worse ventilation. So I think those things still make sense. And again, we've moved into a tale of two populations, rather than the entire country needing to be very concerned and sometimes even afraid, depending on your risk. Back last 4th of July, this 4th of July, it really comes down to those people who remain unprotected. And if you're unvaccinated, this 4th of July is just as big a problem for you as last 4th of July was, only with a virus that is more likely to seek you out and infect you. So I would just encourage people who are unvaccinated to get vaccinated. And then, of course, it's too late to gain immunity from that vaccine right now for the 4th of July. But just to wear your mask if you're not protected, or if you're around people who can't be protected because they're immunosuppressed, organ transplant, immunosuppressive medications of other sorts and the like, And so be mindful and courteous to those people around you who can't get protected. So make sure you protect those people along with yourself, particularly if you are not protected. Any other questions? Okay, thanks everybody. Have a great weekend and a safe 4th of July.
Thank you.
Thanks, Dr. Threlkeld.
Yeah.